Hi everyone, I'm Loretta Bush and I have the pleasure of being the President and CEO for Authority Health. So here we are today on March 14th and it's World Kidney Day. Now many people may not know that. I know that I wasn't aware of it until I started to hear about these very startling statistics and facts. So let me share them with you before we get into a talk with our guests. 37 million Americans have chronic kidney disease. And get this, most are undiagnosed. In 2020, the year we all remember, the first year of the pandemic, the mortality rate, and that means the death rate for kidney disease in Detroit was 1.5 times more than the state's rate. More than 80,000 people in Detroit alone suffer from chronic kidney disease, according to the Michigan Department of Community Health and the Centers for Disease Control and Prevention. African Americans and other people of color are particularly vulnerable to this disease. The National Kidney Foundation of Michigan, together with our clinical team here at Authority Health, we have launched an early detection and early screening program at the Popoff Family Health Center so that we can detect and also work with individuals around their kidney journey. Now here today with me is Mary Wozniak. She is a program manager for the National Kidney Foundation of Michigan. Mary is a public health professional with expertise in many areas. I'll just name a few. She has expertise in community health, in monitoring and evaluation, and in health promotion in culturally diverse environments. She holds a master's degree in public health, and she is a certified health education specialist. Mary, thank you for joining me today.
Thanks so much for this opportunity.
So, of course, we're going to talk about kidneys and we're going to talk about chronic kidney disease. So why don't we start off with you just telling us what chronic kidney disease is, and how does it affect our health?
Yeah, so the first thing I think people need to know is that kidneys are actually vital organs. We need them to survive. So their job is to filter our blood, regulate our blood pressure and how much fluid is in our body. Now, if they're not working properly or their function is declining over time, over at least 3 months, that's what we consider chronic kidney disease. Okay. All right, so some of the effects of that is that it can increase your risk for heart attack, stroke, but also eventually kidney failure, which means your kidneys are no longer working on their own.
Okay. Mary, I tell you, I think when you started off by saying, that our kidneys are very important and that they filter. So they're the filter for the body.
Absolutely.
All right. So then that kind of gets to, then what are some of the symptoms of chronic kidney disease?
Now keep in mind the symptoms generally don't appear until later in the disease when there's really not so much you can do to prevent it from getting worse. Okay. But some of those symptoms can be dry, itchy skin, nausea, vomiting, feeling more tired than usual, poor appetite. Okay. So things like that might not be very obvious, right? But I think what's really important to focus on is those risk factors for people to know what puts you at risk for kidney disease. Sure. So the top 2 causes of kidney disease actually are diabetes and high blood pressure, which are unfortunately very prevalent, very common in the African American community.
So those are 2 conditions then that people who have those 2 conditions are certainly candidates for early screening.
Absolutely.
So
yes.
If people get screened early, are there things that can be done to kind of slow the progression, or is there a cure? Tell us more about that, because many times people say, I'm afraid to go to the doctor because if I go to the doctor, you're going to test for something, you're going to tell me I have something, and then there's nothing. But, you've already said a key point. If you're waiting around for symptoms, you're already too late. By the time you get the symptoms you've described, you're well into chronic kidney disease.
Yeah,
so talk to us about, why it's important to screen. Is there any interventions that can happen early on?
Absolutely. So early detection is really the key focus of our healthcare initiatives, is really to drive screening for people who are at risk of kidney disease. And the reason for that is there's so many opportunities. While there's not a cure for kidney disease, there are a lot of ways to slow down that progression and keep your kidneys functioning as healthy as you can. So we're talking about things like lifestyles, but also there are many medications now that have come out, and many more are still being researched, that can protect your kidneys over time. These are also medications used for diabetes to control your blood pressure, and they're also finding they can protect your heart because all of those things are interrelated. The metabolism in your body is related to how your kidneys function, and that kidney function kind of impacts your blood pressure, which impacts your heart muscle.
Absolutely. So it's all there. It all works together. You mentioned one of my favorite words. I know that sometimes people shy away from the issues of lifestyle, saying, you know, I can't impact what you do when you go at home. But people at least need to know what some of those lifestyle changes are so that they can have choices. So what are some of those lifestyle changes that we can engage in to slow down kidney disease?
So we're talking about things that are also going to help you with your diabetes or blood pressure if you have those. Things like physical exercise, moving your body, of course. Nutrition is very important when it comes to kidney disease, knowing what you can or can't eat. Really reducing sodium is very key to that. And then what some people may not realize too is that there's certain medications that can actually further damage your kidneys. So for people taking ibuprofen or NSAIDs every day, that's something that can actually be further damaging your kidneys. So these are all points that we're as through our partnership with Authority Health, making sure that the providers and the healthcare staff understand what those risk factors are, and then the healthy lifestyles to be able to talk with the patients and kind of motivate them to try out those healthy lifestyles.
Absolutely, and that's key because you know, probably all of us have ibuprofen in the medicine cabinet. But if we are someone who has early kidney disease or further on in kidney disease, it may not be our best friend.
Right.
So knowledge is important for us to know. So we've been talking about what you can do early on, but sometimes CKD, chronic kidney disease, gets worse. It gets worse over time. And so talk to us about what happens if it's left untreated.
Right, so you can end up with end-stage renal disease, which is kidney failure. And that's the point at which you kind of need to make a decision on what type of dialysis you might use. Dialysis is basically an artificial kidney. It's a way of filtering your blood with it, not using your kidneys. And then kidney transplant is also another way to treat and have, you know, a functioning kidney.
Yes, yeah. And so probably many people know either in their family or their friends who are taking dialysis and all of that, and that is a result of end-stage kidney disease.
End-stage kidney disease, right.
And so that's what we want to avoid.
Yes, ideally.
Absolutely.
Ideally.
So even though it can't be cured, we've been talking about early detection and that there's some things that we can do to prevent it or slow it down. And so Mary, again, we kind of was on the edge of it, but let's talk specifically about what we can do, our listeners can do, to prevent kidney disease or to slow kidney disease down.
Well, I would say the first thing is really knowing that risk. So we actually, the Kidney Foundation has a risk quiz if you're interested in taking that. That's at kidneymi.org/risk quiz, kidney quiz, sorry. And that's just a 1-minute quiz. It's really quick, and it'll give you a sense if you are at risk. You can also sign up for email updates and get more information on how to talk to your doctor about it, and other lifestyle factors to consider. So that's kind of a starting point. The testing for kidney disease is pretty simple. It's a blood test called the EGFR, plus a urine test called the UACR. So that's what we're working with the folks at Authority Health as well as the medical residents to really train them on what are those standardized protocols and how can we make this just a standardized part of medical care.
Awesome. So we are talking to Mary, and pronounce your last name, Mary?
Wozniak.
We're talking to Mary Wozniak, Program Manager for the National Kidney Foundation. We are working with the Kidney Foundation to do early screening, early detection of chronic disease. And when I say we're talking about the clinical staff at Popoff Family Health Center. So if you or someone you know is in need of a primary care provider who also can provide you with early screening, early detection for kidney disease, call 313-824-1000, pick prompt number 1, and one of our physicians at the Popoff Family Health Center will certainly be glad to see you. Okay, so we kind of talked about how can a primary care provider really help in this effort. Did you want to say anything more about that piece?
Sure. So we're really focusing on that early detection piece, and then kind of really making primary care staff more confident in how to then manage those earlier stages of kidney disease. Okay. So at a certain point when your kidneys get, that they're not functioning very well, you might be referred to a kidney specialist, which is called a nephrologist. But before that, there are those newer medications we talked about. There's blood pressure control, and just so much education that can really impact a person's overall health. And the other thing I want to say is, outside of the four walls of the health center, there's so many other things and other factors that impact our health, right? Mm-hmm. It's access to a safe place to go and get physical activity outside.
Yes.
It's being able to afford fresh fruits and vegetables and having that available in your neighborhood. Mm-hmm. So that's one of the reasons I'm really excited for this partnership, is I know Authority Health is really active in this space and responding to those community needs.
Yeah. It takes it all, Mary. Mm-hmm. And so, because we provide clinical services, we're excited about that, but we know what you talked about, it doesn't end within those four walls, mm-hmm. right? When people leave out, they need to have other connections and other ways to be able to do those lifestyle changes or to mm-hmm. support lifestyle efforts that they already have. And so the ability to be able to connect with fresh fruits and vegetables, exercise. I know for me, I love to pop on YouTube and just do some of those free mm-hmm. walking tapes and things like that if I don't feel like I can get outside. Mm-hmm. So it's all very important. So, it's great for us to be talking today on World Kidney Day, and the theme is Kidney Health for All. So how is the National Kidney Foundation commemorating this day, other than spending your time here with me?
Well, I'm happy to be here. A lot of my colleagues are out at some health fairs and community events. We are offering a number of free kidney screenings out in the community. And for more information on that, you can check out nkfm.org/kidney month. That has kind of all our events going on. There's also some educational sessions coming up if you'd like to learn more. There's a whole Grand Round series that the Center for Rural Health is hosting for us. So we're just excited to get the word out there.
Absolutely.
About this important topic.
So Mary, is there anything that I haven't asked you about this topic around kidney disease, around prevention, around any of this? Is there something that you would like to leave this audience with? Yeah,
the other thing I wanted to highlight that you talked about prevention. I did want to say that the Kidney Foundation offers quite a suite of programs for self-management of chronic diseases. So that's really getting at those skills like communication with your doctor, adhering to kind of those medication treatments, mm-hmm. but also stress management. I mean, stress has such an impact in our ability just to get through the day and take care of ourselves. So those programs are something we're offering and letting the staff know at Pop-Off as well. They're free to the public. So if you want to explore those, please visit nkfm.org. And then I know Authority is also hosts a number of education that like the community health workers are engaged in. There's this great community kitchen. If you haven't checked out the Ruby Cole Kitchen at the Pop-Off Center, it's beautiful and just a great space for the community to come and learn how to cook, like healthy, fast, easy meals.
I tell you, you do a good job of explaining what Pop-Off Family Health Center and Authority Health does. And we are so happy to be able to partner with you on that, because that's really how the word gets out. Mm-hmm. And that's really how we have programs that are not siloed, mm-hmm. but they're all connected within Authority Health, Pop-Off Family Health Center, but also connected with the National Kidney Foundation, with farmers markets, with other entities that really can help people on this journey. Mm-hmm. One of the things that you mentioned when you first started speaking was talking about programs that can help individuals to know how to talk to their providers. And this is another thing that at Authority Health we try to focus on, and that is the fact that you can be literate, but you may not be health literate.
Health literate.
You can be confident, but you may not be confident when you go in to see your provider.
Absolutely.
So I'm very excited that the Kidney Foundation is doing things to support individuals in that space with the best price ever, free.
It can be intimidating to ask those questions of your doctor. So we want to provide a space where lay health people are actually trained to lead these programs, and so that it's very conversational, and you're learning from others who are experiencing the same types of disease as you are on how to manage that. And then we feel that's a nice complement to the communications that's happening between the medical staff and the patients themselves.
For sure. Well, it has been a pleasure.
Yeah,
it has been an
this has been
absolute
great.
pleasure talking to you today, and even more for Authority Health to be partnering with the National Kidney Foundation to be able to provide early detection, early screening for kidney disease, but then after that to really be a partner in that journey to prevent progression, or at least slow down progression. So remember, talk to your primary care provider about kidney disease. If you have diabetes, high blood pressure, heart disease, obesity, or a family history of chronic kidney disease. As always, here at Authority Health, we believe that knowledge is power. So now you know. We'll see you next time.